Hi, my name is Dr. Bajwa. I'm a veterinary dermatologist in Surrey at the Vet Derm Clinic. I'm here with Dr. Juanita, and the CAVD did a survey recently asking veterinarians for their most common questions that pet owners ask them about dermatology. So what is my question, Dr. Juanita?
All right, your question today, Dr. Bajwa, is why do we need to do all these tests?
Why do we need to do all these tests? That's an excellent question, and definitely in veterinary dermatology, there is normally a layer of problems that pets are brought to us with. So it could be an infection, or maybe more than one infection. Bacteria and yeast are common. Parasites can be common, and then underlying processes that cause the skin disease or ear disease, which could be potentially environmental allergies, food allergies, hormonal issues, autoimmune skin conditions that can lead to these secondary infections. So often to find out the true extent of what we're dealing with, because everything visually looks the same. It's, crusting.
That's the hardest part, isn't it? Like
Exactly.
Everything looks the same, and so you have to peel it back.
Absolutely, yeah. So we see crusting of the skin, we see scaliness, hair loss. Itchiness is a very common symptom with pretty much even non-itchy skin conditions sometimes because of secondary infections. So we do need to do tests to figure out if your pet has an infection in the ears or on the skin, if they have multiple infections, and then treat the infections, but also focus in on the underlying cause, which needs testing. So there is testing to figure out if there's infection or not. There's testing to figure out what the underlying issue is. Some pets may be affected with more than one infection and maybe even more than one skin condition. It could be a food allergy along with a hormonal issue like hypothyroidism. So if you diagnose just one of the 3 or 4 things a pet is presented with, maybe we cannot make them as comfortable or as happy as we could if we got everything done together. And sometimes there's benefit in just knowing that maybe your pet does not have a skin infection. Often dogs with environmental allergies or eczema can actually look like they're infected, but they're not. So giving them antibiotics would not help them or may not be the best thing for them. So it's often very helpful to find out what we're dealing with. And also, I like to focus in on the odor, because a lot of times we think about my dog is smelling yeasty or the ears are smelling yeasty. Are we dealing with, well, we're obviously dealing with a yeast infection. Not always true. Seborrhea can cause an odor, which may or may not be yeasty. Sometimes I feel a dog has an absolute bacterial infection based on how they look, but I do the testing and there's yeast, or vice versa. So the smell test, the visual test, it helps us guide treatment, but we don't always know everything. We're hopefully good, but not that good in terms of finding things. So testing leads us to the right path and helps us do well from a starting point, but also to monitor progress for our pets so we can keep them happy, non-itchy, healthy long term.
I was just going to ask about that, because I think also, like you mentioned, having more than one thing going on. So if you have an infection and an allergy, or you're hypothyroid and an allergy, having to retest after you start treatment to say, hey, did we successfully take this out of the mix? And now the clinical signs should be just related to, the underlying problem.
Exactly, yeah. So itchy dogs, often when they come to me, they come in with an infection and an underlying issue, or more than one issue. So, and oftentimes we're able to kill infection appropriately after doing some tests and figuring out what needs to be done. For example, if you see bacteria, do we just do antibiotics? Do we do shampoo therapy? Maybe we do a culture, which is another test, before we do antibiotics to figure out, what is the best treatment for this particular pet. It's very individual. But when they come in for a follow-up in a few weeks' time, maybe they're still a little bit itchy and crusty to look at. But a test would actually, like a cytology test on the skin or the ears, would tell us if this is the allergy impact causing them to be still a little bit itchy, even though they may be better. Or is it the infection persisting and not going away with what we planned the first time go? So if the infection's gone, we don't have to do more antibiotics. We don't have to overthink it. And the way we find that out is by doing a little bit more of the testing. Often these tests are patient side tests where dermatologists and some veterinarians can definitely do these tests in clinic and get answers right away. So you don't always have to wait for the test to come back from the lab, although sometimes that may be the case as well.
That's awesome. Thank you, Dr. Bajwa, for explaining to us, while we all want to be a crystal ball, why we can't be. All right. Well, hopefully I'll see you again and we'll do another one. Have a good day.
Thank you. Bye-bye.